book that describes Medicare for 2025. I haven't gotten mine yet. You have yours? Okay, so some of them are out. You know, I'll be honest with you, until I was doing the presentations, I never really read the book. But there's a lot of good stuff in there that tells you exactly how Medicare works and what it will and won't do and what to do if you have a problem. But I know you're not going to really look at it, so I printed out 2 pages offline on the computer off of their website to give you today, and we're going to talk through those. But what I'm going to do today is, instead of doing PowerPoint and all, I'm going to walk you through these handouts I gave you. So if you'll follow the handout, I think it'll be the best way to go. And so let me give you a little bit of information. Trudy, Beatty was going to introduce me, but I'll introduce myself. It'll take the hassle off her. I live on Waverly Court. Been here for 1.5 years with my husband. I'm a nurse of 50-something years. I have a master's in healthcare administration, and I've done all kinds of stuff, from teaching in a community college setting to teaching in an MBA program at a university to being in administration in hospitals and clinics and all that good stuff, plus some nursing, actual patient care. But for the last 9 years, I started a private practice, and I'm kind of not doing it much anymore because my husband needs me around a lot, but it was on patient advocacy, because so many people don't know how to get through the healthcare system effectively. And the healthcare system keeps changing on us. And back in the day, we kind of just let them do whatever. We didn't really have to worry. But now the responsibility is really on each of us. So I called the talk today Metascary, because A, it's close to Halloween, and B, most people don't know much about Medicare, and it's scary to make the decisions that you have to make about your Medicare. Now, if some of you in this room have a power of attorney or somebody that is taking care of your insurance and all, we need to try to get them to one of these workshops. I know we're doing another one early in October, but because they can help you make some of the decisions that you have to make. It's not one and done anymore. You can't sign up this year and think that you need the same thing next year. You probably do need the same thing, but you have to check a few things. And so today I'm going to talk about that. So I said, it's time to enroll, and then I cut off the date. October 15th to December 7th is the time that you have to enroll without any penalties in whatever Medicare program you want. However, it's easy to go from traditional Medicare, which I'll talk about in a few minutes, to an Advantage plan, but it's not as easy to go from an Advantage plan to traditional Medicare, and there's some paperwork involved. So we can talk about that. There's other reasons for being able to change at a time other than this couple of months right now. For an example, I had a client who lived in south of Winter Haven, but he moved to Orlando. That opened up the window for me to get him into a different insurance plan that was going to cover him better up there. So those kinds of things. Big life-changing events are another thing that they will let you go in and make changes if you need to. I'll give you an example going back to my man. He had pretty serious Parkinson's. He was going downhill. His wife was very unstable, and we were moving them from their home to an assisted living up in Orlando. He had an Advantage plan, and I don't even remember which one it was. But the coverage for specialists was very poor on his particular Advantage plan. They're not all like that, but on his plan. So we wanted to get him into traditional Medicare with a supplement because we knew he was going to need all kinds of neurospecialists up in Orlando to be able to take care of him and get him improved if at all possible. So we used the opportunity with Medicare to be able to change him from that Advantage plan to a regular plan and an insurance plan up in Orlando. So that's what I'm talking about. Those are the kind of things that happen that you might need to change your plan. Now, another thing that happens is that not all doctors and hospitals pretty much, but not all doctors take Medicare. So the first thing you have to be sure of when you go to a doctor is that they take Medicare. And the reason a lot of them are dropping out is, guess why? They don't get paid very much. So if you look at your bills ever, it says doctors charge $250. Medicare allowed amount, $32.95. That's because somewhere along the way, $32 was negotiated by the business manager for that doctor to be able to take Medicare. And it's all about quantities. So if he would charge you, if you go to him $200, but he gets a whole bunch of Medicare people at $32, that's the reason the doctor would take Medicare. But we are seeing some of the doctors drop out of Medicare because they don't want to deal with all that. Plus, there's all these accountability points that they have to do along the way to show that they're making the right decisions for their patients. Not all hospitals and skilled nursing facilities take all insurance plans. So you may have, I want to make one up. You may have, Mary had a Little Lamb policy from, company, and if the skilled nursing facility here doesn't take it, then they either need to try to get an individual contract, or you're going to have to pay cash or credit card or whatever else. That's something that, there's a fine line here. So some of the Westminster people were going to be here, but they have to be very careful because it's seen as coercion if administration says, we want you to change your plan to this or that. So they can't tell us that. But I can, because I live here. So what I can say is, you need to see if this place is on your insurance. And because if you get sick or break your leg and you end up in skilled nursing for a period of time, we want to be sure that your insurance company is on the approved list, which I have and I will give you when we're done. What they do, and I'm skipping to the end, but I'm going to do it right now because I think this is an important point. Just because we all bought in and we're all here doesn't mean that we can go to every level of care right free. It costs money to go to different levels of care. So if we end up needing skilled nursing, we want to be sure that our insurance is taken by Westminster. And Westminster is adding more and more, and it's really Westminster Lakeland, because I think each facility does it separately, but to try to negotiate with these insurance companies so that they can take our insurance. Now, have I totally blown your mind and confused you? Okay. Does everybody understand that if you want to go to our skilled nursing facility, you can go always. There'll be a bed for you. But if your insurance is not accepted here, and if they can't negotiate with your insurance company a one-time exception, which they are able to do sometimes, then it would be a cash out of pocket, or you'd have to go to a different skilled nursing facility. And that's not a scary thing, it's just a matter of fact. But they are in contract with all the big companies, so it's really not a big worry. But if you have had a Little Lamb insurance, it might not be on this list. Now, did you have a question?
When you say Medicare, is that
For this conversation, I'm just saying, I'm saying Medicare. So I'm going to get ready to go into that part of it, so hold that thought, and if I don't cover it, you tell me. All right, so out of state and out of country can also affect your insurance, your Medicare, your supplement, your Advantage plan. So these are a few things that people sometimes just don't get. So if you have an Advantage plan and you live here, but you're in Oklahoma for 2 months of the year, and your doctors are not in Oklahoma, are not on that Advantage plan list of doctors, then you may or may not be able to get anything but emergency care. A lot of people don't know that. If you go out of the country and take a cruise, everybody's going on cruises these days, you take a cruise, your Medicare will not cover you. Your supplemental policy, in some cases, will, and they pay up to $50,000. But I have a really good friend who just had a massive brain hemorrhage in Switzerland. His bill was $250,000, plus a $50,000 bill to fly him back to the U.S. He did not buy travel insurance, which is your other option, to buy the medical travel insurance, which we all hate to spend the money on, but it's worth it if you have an emergency. So all they got was $50,000. And they tried to negotiate with the hospital in Switzerland, and there's no negotiation. So they owe that money. So what did I just say? I said that there's two situations. If you have an Advantage plan, we're going to talk about the difference in a minute. Regular Medicare is good, traditional Medicare all over the country. But an Advantage plan is always regulated by the zip code you live in. So when you get that big fat book that comes to your house that I talked about before, in the back, it lists plans by zip code and state. So you can see what's available. So you have to make sure that the doctors, and I'm going to talk about that in a minute, the doctors and the hospitals that you want to go to are covered by your insurance. In most cases, they'll all be covered by traditional Medicare for the hospital stay and some of the lab and PT and stuff like that, but not all of the insurance supplements or the Advantage plans will do that. Okay. Yes, ma'am.
If one changes from Medicare to Medicare Advantage, what is the waiting period for pre-existing conditions?
I don't believe there is any. I'm not an insurance agent, and I know every Advantage plan has different criteria, but with the Obamacare Act and all the trickle down from that, I believe that there's not pre-existing conditions. But a lot of them might not accept you because, we'll talk about that in a minute, because you're higher risk for them because you have a pre-existing condition, or they might make the premium higher.
People ought to be careful.
Yes, and we'll talk about that. Your health is really important, and yours are not the same. So, one size does not fit all. Okay, so the next page says there are two versions of Medicare. Traditional Medicare, which has been around forever. And I know this gentleman, you came in later. Do you have a handout? I'm following a handout, so let me give you one. Anybody else not have one?
I'd like one.
Okay, sure.
Thank you.
He's going to hog it. That's okay. All right. So there's two. There's traditional Medicare, which, you get when you're 65-ish, and everybody gets it for free because we paid for it through our life, through things that were taken out of our paychecks and stuff like that. Very few people have to pay for Medicare, although there are some people who do. All right. And that is that covers certain things which we're going to go into detail in later. And then there's Medicare Advantage plans. And you get one or the other, and you choose. The Advantage plan is like a whole package, from medications to doctor visits to hospital, all rolled into one. Concept is fabulous. The concept is great if it works. The onus is on the doctor's office, who's your primary care doctor, PCP, to coordinate everything. And we know how well that works, right? Not always real well. There are some offices that do a great job at it. Some of them have hired extra care managers and people to work with their patients to help them. And we're going to talk specifics in a minute. My next thing is nothing is free. So if you don't know the terms of deductibles, co-pays, length of stay, co-insurance, medications, I was going to go into them all and decided, nah. But every insurance policy, whether it's a supplement or an Advantage plan, has different amounts that you pay in addition to what they're paying for a service. And in some of them, there's always a cap. But the cap is lower usually in an Advantage plan of what you have to pay. However, you don't get much choice in an Advantage plan. We'll talk about that. The Porter-McGrath skilled nursing payment requires insurance, or you have to pay. I've already said that. And only certain plans are under contract. And that's whether it's a supplement or whether it's an Advantage plan. So it's to your advantage to make sure that your fancy insurance is on the list or that they try to get it on the list. Okay, then the next thing I talked about was outpatient PT and rehab. So every time I see something come across that says, oh, the dermatologist will be here or the podiatrist will be here, and I'm going, yeah, that's good as long as you're on their insurance. And again, it's usually Medicare. And usually the Medicare will cover those things for seniors because they know that the long-term effects of bad feet and bad skin is more expensive than fixing it in the first place. Yes, Paul?
You mentioned supplemental plans and Medicare Advantage. And what the scope would be about.
I'm going to go into detail. I'm going to go into detail. I am. I'm kind of giving you the big bullet points and then we'll go into detail. So I've been really bugging them here because if you need PT, outpatient PT, and you want to do it here with Lisa or whomever, how do you do it? Well, you've got to get your doctor to send a prescription over here or get you to bring it over here. Most of them want a fax number. Most of them do it electronically. I don't think we're that sophisticated here yet that we're doing the prescriptions by electronic. But you got to get the prescription, then they'll check to be sure that they're on your insurance so that they can do it. And again, in most cases it falls under Medicare and they'll cover it because they know it's a lot better to do prevention and rehab and things like that, meaning the government, than to let you not have that. Nursing home care. This is important because I found a lot of people don't know this, and my clients, I find this all the time. Nursing home care is not covered by any health insurance. They're front and back. No, yours isn't? You don't have something on the back? Well, that's very weird. Maybe when some of them got copied. Oh, I don't have any extras. Some of them are you missing the pages? Oh, that's good. I wonder who copied those. Try this one. Yours isn't like that? Oh, yeah, yours is a mess. Yours is all front pages. There's some on the seats. Let me see. Who else did not have one that's front and back? Okay. It was an amateur. Back in my other life, I had assistants to do all that stuff. Anybody else need one that's correct? Okay. All right, so it's always a big shock when somebody has to go to the nursing home and they find out, and usually it's the kids, and they go, what do you mean? No, Medicare doesn't pay? No, not at all. It's 100% our responsibility. So you have to plan for that. And people hate to spend their life savings on nursing home bills, which are around $9,000 to $12,000 a month. You need to know if you have long-term care insurance. Some people took out long-term care insurance policies. It's too expensive now to do it. I didn't do it either, and I wish I had. But it's too late, because now it would be...
There's a certain age cap.
Well, there's an age cap, or they charge you, $500 to $700 a month for it, so you might as well put the money in the bank and pay cash later. But I just want you to know that it doesn't cover it. So let me give you an example of what happens. You get sick. Let's don't say you. Let's say somebody you know gets sick, and they go to the hospital, and they spend at least 3 nights, and then they're very weak, so they go to skilled nursing. Okay, and the Medicare will typically pay the first 20 days whether it's an Advantage plan or regular Medicare, as long as the Advantage plan is under contract. And then about every 20 days, they have to evaluate your situation to see if you're making progress. And if you can't make any progress, then you would have to switch to the long-term care side, at which the Medicare stops. If you're making progress, Medicare will pay a portion up to 100 days. Very few people I know have made it 100 days. They either get better and get out of there, but some people do. Okay? But they have to actually document for Medicare, who Big Brother watches from above, your progress against national criteria to allow you to stay there and get it paid for by Medicare. Are there any questions about that? I just want to be sure that all of us as residents understand that we still have to have our insurance to cover our skilled nursing, and then there is no such thing except for long-term care insurance that will pay for the long-term nursing home type care. Now, there are estate planning attorneys who can help you with this and can guide you to how to kind of move your money around and stuff as you get older and need maybe this care, or your spouse needs this care, so that both of you don't lose all your money just because somebody has to go to the nursing home. And they're very crafty at what they do, but it's a skill. It's a real skill for them to be able to do that. You can also go on Medicaid, and they do take Medicaid here. Not all nursing homes take Medicaid. Most of them have a few beds, but you have to not have more than $5,000, and it's a 5-year look back, so you can't have gotten rid of it all last month and given it all to your kids. And you can have a house still, and you can have a car that doesn't count against you. So you have to really have spent your money way down. And then there are several versions of Medicare, whether you, for long-term, whether you live in your home or whether you live in the nursing home of Medicaid. But you just need to know that those are things, and I always tell everybody, I know people don't like to do it, but you really need to have, if you got any money at all, you need to have an attorney look at it with you and guide you as to how to protect it as you get older.
Does Scott Langston do that?
Yes, it does.
He does.
We know that, that to get in here, you know, people had to have some assets, but you want those to last as long as possible, and you want to be careful with those. So there's the Loving Care Fund, but believe me, they're not going to let us use that unless we've exhausted all the other things. So you need to take the initiative to you or your family or somebody, make sure you're on top of that. I want to talk about the medication plans right now. Not all medication plans, and I'm going to get into the difference between the plans, but not all the drug plans take care of all meds. Every company that covers medications, whether it's an Advantage plan or an insurance company, have a list. The official name is a formulary, but it's easier to call it a drug list, of what they cover and what they don't. And some of them have chosen to drop off some of the more expensive medications because it's all about risk. They don't want to spend all their money on those expensive medications. In the Advantage plans especially, you may have been taking one kind of insulin your whole life, but you get on a certain Advantage plan and they don't have that one on their formulary, so you have to start over with other ones, and the pharmacist over here is shaking her head yes, trying to get your body adjusted. So you need to know what drugs are covered on your medication plan. They all post it. Now, last year I told everybody to go to their computer and look at their portal and look at their account, and everybody looked at me like, and you think we have a computer that we look at all the time? So I know a lot of people in our age groups don't use the computer a lot. And I'm kind of vying for a computer lab here that those kind of things can be done in, but you know, I'm kind of tiptoeing into that. But it's a real issue. You know, I would tell you, you know, go look at the formulary or the drug list. But in this case, in most cases, you're going to have to call them up and get a copy of the list because you probably don't have a computer that you can go to and pull it up yourself. All of them also have a deductible on the medication plans, and some of them also have a co-insurance, you know, like the $15, $30, that kind of thing. So again, we're not going to go into detail about that, but that's something that happens when you have the medication. When you have an Advantage plan, I don't know of any plans, but I don't know them all, that don't include the meds, the medications. When you have traditional Medicare, you need to get a supplement plan, like Blue Cross or United or whatever, and then you need a Plan D, which is a medication plan, which may be from somebody else. And so now you're juggling deductibles from all of those different things and payments to all of those different insurance companies. And some people just throw their hands up in the air and say, I can't deal with this. But the reality is if you don't, then you may end up with a big bill because unknowingly you found out that they didn't cover something that you need. So what's new since we talked before? There is a slight increase in the drug plan D's premiums, expected. Now, Medicare site says $2 a month. Well, I can handle that. That's not too bad. But I want to see it to believe it. And every drug plan can make their own premium. And premium is the amount monthly you pay for that drug plan. There's no more donut hole. Do any of y'all remember the donut hole? So you get your medications and you get up to, say, $1,500. And all of a sudden, your insurance plan doesn't pay anymore, your drug plan, until you hit $2,500. So you're out of pocket for all of that, and then it pays again. So if you're on some really expensive drugs, you're going to pay all that you paid up to here, your premiums, then all that they cost in this however many month period, and then they'll pay again. It's gone. Effective 2025, it's gone. And the maximum out-of-pocket that any of us are supposed to have to pay going forward in 25 is $2,000. That does not include our premiums. So obviously that's why the premiums are going to go up. Now, I'm suspicious that the deductibles are going to go up too, because every medication plan, right, has a deductible too before they'll pay for your prescriptions. So I know that my husband's on Eliquis, so I know that we're paying $400 and something, you know, right in the beginning. But that's going to change too. So, like the government or not, somebody in their wisdom was able to negotiate down prices from the pharmaceutical companies on 10 or 15 expensive medications. And that starts in 2025 and will be in full effect in 2026. So for an example, that Eliquis I just mentioned used to be a $450 drug through your insurance, and now it's going to be like $220. I mean, it's still a lot of money. But if your maximum out of pocket is $2,000, you're still coming out better than you did before. So when you start looking at your plan, you have to look at how much is it going to cost me each month, and what's the deductible before that $2,000 starts? Have I confused you? This is new. It's better, but it's got some tricks in it that I don't know how they're going to work out yet. And again, I'm not an insurance person. I'm on the hospital administration side in the past that, you know, had to see if you had that insurance, and did you know this rule? And because, you know, people were saying, why did I get billed for this? And then I fought in my advocacy practice. I would fight with the insurance companies or try to negotiate with the hospitals down for a cheaper rate for my clients. Yes, ma'am.
Are you responsible for documenting that 2,000?
No, it's all done in the system. Wherever you get your pharmacy, they're monitored also up the line, so all of that has accountability in it. So what do you do? Number one, you got to look at your health needs. If you've got cancer and you're taking medications every month, your situation's different than somebody who has high blood pressure. And your needs are different. Okay. The other thing is who are your desired providers in hospitals, and are they even on the insurance? And that's a big one. A big example is, I know when I had my breast cancer, I wanted to go to Moffitt. It was on my insurance. It's covered. But a lot of plans it's not. And that was a big thing when I was having clients and they wanted to go to MD Anderson or to Moffitt or to Mayo. They weren't on their insurance. And the Advantage plans are tricky. So if you have a lot of health problems, and they're serious ones, then you really need to check those Advantage plans to be sure they cover what you want. The second thing I said is look at your medication coverage, drug list, deductibles, pharmacies you like to use. If you only want to go to Publix, then you don't want one that only does mail order. So again, gotta look. As a rule, a 90-day prescription is a little cheaper than a 30. So it comes out, average is a little different. So if you're taking something, if you're taking something on a regular basis, then you want to get your doctor to write it for 90 days unless he thinks there's going to be a change or he's trying to regulate something. You've got to find someone to do it for you or do it yourself to examine a variety of plans, prices, and you got to see if they're covered in the 33815 zip code. Now, last year I did learn that some of our residents live in 2 places. Okay, so those people, I would warn them, if they have an Advantage plan, that's going to be tricky. A lot of them have federal coverage, and that's kind of a little different plan. But if you live for a long time in 2 places, be sure that your providers in both places are covered by your insurance. They may not be. Then I said review the list of Westminster contracted, which is, this is what it looks like right now. It's not very pretty. And I'll give you that at the end. And any other ones, I think we can contact Alyssa and her staff to find out if they have a contract with any other companies. I know they're working on a lot of contracts because it has come up in the past. And then if you're admitted to the hospital, this is a big one. If you're admitted to the hospital from here, be sure that the hospital knows that your home, not just your address, but your home is Westminster Lakeland. Because if your insurance is not contracted with us, the care manager might send you to another skilled nursing facility when she could have called here and negotiated the rate. They don't know that Waverly Court is Westminster Lakeland. So you've got, and tell your friends and neighbors the same thing. When you go to the hospital, you got to tell them, I live at Westminster Lakeland, my address is this. Because I want to go there. If I have to go to skilled nursing, I want to go there afterwards if possible. And then they will call here, and if they don't accept your insurance, they'll try to negotiate with your insurance company so you can come back here. Does that make sense? Okay. All right, so let's look at the last 2 pages of your handout, which I seem to not have a copy of. And that is directly out of the Medicare. Are we back to the last pages of the Medicare handbook thing? Okay, so what I did was pull this out just to kind of go through specifics for you. And if you'll look at page 9, it says, how are we doing time-wise? We okay? Are we running over? Okay, all right. What are the parts of Medicare? Looks like this. It's on the second to last, it should be the second to last page if you got a complete handout. It's got a corner, up in the corner it says 9, I just copied it right out of the book. Yeah, you got it. But there's 2 pages of that. So you've got, yeah, so go to, And it was kind of printed in a weird order, but I went with it anyway. All right, so what are the parts of regular old Medicare? There's Part A and Part B, and this tells you what's covered under each of those. So you see how inpatient care, skilled nursing, that's us, Porter McGrath, hospice care, home health care. And then it tells you where in your manual you can find out more if you ever get your book, okay? Then the B, Part B, is your medical insurance for doctors, lab tests, all those kinds of things. Wheelchairs, walkers. So those two are rolled together in an Advantage plan, whereas in a traditional Medicare, we have Part A and we have Part B, some of it, and then we get a supplement, which they also call a gap plan. It fills in the gap of what Medicare doesn't pay. So that's your Blue Cross, United, Humana, whatever it is, not the Advantage plans. Okay. And then Part D is your drug coverage plan. Now, I'm retired from the state of Florida. I had 15 years in, so I'm on state of Florida retirement insurance, which is Blue Cross Blue Shield, and my Part D is rolled right into it. My husband is on teacher retirement, and his Part D is not rolled into his. Go figure. So he has to have a separate D plan. All right. If you turn the page, it talks about your original Medicare and Medicare Advantage. And sometimes they call it Part C. So just look at that for just a second. Go down the left side. Original Medicare is what we've talked about. And then at the bottom it says you can also add supplemental coverage. And that's running anywhere from $200 to $500 a month. It's $200 to $500 a month for supplemental plans. $200 to $500. $200 to $500. And we were talking in our neighborhood the other day because now I know in the state of Florida we have our choice. We can get an Advantage plan and not pay anything for it, hardly. Or we can stay with the Blue Cross Blue Shield, but we still have to pay like $300 and something a month for it. Even though it's a retirement plan, we still have to pay a certain part of our insurance. So anyway, what I'm saying there is that this is where I'm talking about you get a separate plan that augments what your Medicare, and you still need to look at it every year because the plans can change every year. So you get a supplemental plan, you don't keep it for life, you check it every year to see if it's still the right plan for you. Now I know logistically, most seniors don't do that. At least that's been my experience, so I don't do that. And then they get shocked when they get some kind of crazy bill because their insurance company changed something on them and they didn't know it. If you've got a good rep, and we're not allowed to give you any names of reps or anything like that, can't recommend insurance companies, all that stuff, it's against all the state rules, but if you go to people that can give you choices and you then find out which ones are best for you, yes.
But can you go to that state organization where you can call those people and they will look over things for you? Can you give them that name?
Yeah, I'm going to do that at the end. Okay. Now let's look at the Advantage plan, just to be sure that you all know what that is. There are tons of Advantage plans. Some look really good. Some, I'm not too sure. And again, I said it's only as good as the doctor who coordinates the plan, your PCP. But the unique thing about the Advantage plans, and yes, some of them are free, and yes, some of them have hearing aids, and yes, some of them provide dental and grocery supplements and all that stuff, but you give up your choice. So if you want to go someplace that's not on their list, you cannot do it without paying yourself. So you find out that the only place to treat that brain tumor is out in Utah, and it's not on the list. It will be very difficult for you to do that. I'm not against Advantage plans. I'm just saying they are great for healthy people who have a good doctor and work through the plan. Or if your income is just so strapped that you just can't afford that $300 or $400 a month, that's a lot of money. But know what you're getting. So you have to look at the drug list, you have to look at hospitals, you have to look. I had a friend that went to Baycare and it wasn't on the list. So, you know, and it's interesting because sometimes it's not real obvious up front. I don't know if any of y'all have ever used that Brandon Hospital ER HCA down on South Florida, way down there. But I know somebody that got sent from there to Brandon to the hospital against their choice because that was the Brandon Hospital ER. So you have got to stick up for yourself. And I feel like I'm the doom and gloom queen at that point, but it's really true. And the reason, I didn't tell you that, the reason I decided to do the advocacy piece after all those years was that I was an only child taking care of both of my parents who were dying at the same time. One had Alzheimer's and one had oral cancer. And I was working at Moffitt Cancer Center at the time in management, and I was driving back and forth, and I needed to be there for my parents. And I learned that I still ran into every stumbling block there was. And I thought, well, if I've been doing this all these years and I'm still running into all these stumbling blocks, what are the poor people out there doing that don't have the knowledge, the background, and everything else that I had? So I thought, I've got to get out there and help some people get through this system. And again, most of my clients were the kids of their parents who were struggling with trying to help them make the decisions and things. So the other thing is, if you look down this list, you have to often get approval from your doctor if you're in an Advantage plan. Now, sometimes Medicare will require approvals for really expensive, like PET scans and stuff, but this is different. This is, you know, if you want to do whatever. And the thing that you need to know is that you're not paying much. The way the doctor makes money on Advantage plans is he gets bonused, usually quarterly, by keeping tight control on the services he allows to happen. So there's a report card, and the report card goes to Medicare, and they look at how many MRIs were ordered, how many lab tests were ordered, how many everything were ordered, and that doctor's office gets bonused depending, because otherwise they're only getting like $13 to see you in the office. Well, they can't survive on that, so the way they get paid is by holding tight on the services, and that's why everything has to be approved. So like I said, it's great for some people who are healthy or on an absolute limited income and that's all they can afford, but know what you're getting. Then the last page is, wait a minute, how come I don't have a last page? I tell you, that person that copied these really didn't do a very good job. Did I finish it? I guess I did. No. If you look at that at a glance page, yes.
Force my insurance company to answer me. I want to know if they approve the questions or not. Please don't answer me.
Well, then I would certainly think about that, not keeping
I
that.
don't have a choice. It's corporate insurance.
Oh, okay. And so what are you asking them?
Well, to make sure that I can come here if I need nursing care, that they have an agreement with questions.
And they won't tell you?
They just don't answer me. I put it in writing.
And they still didn't answer it?
I've written twice.
Do you have like a retirees department from where can you complain through them?
They go through them.
That's what I would do, and see if they can help you. And just easy, what's the name of the company?
It's Air Canada's corporation.
Is what?
Air Canada.
But is Air Canada the actual insurer?
They're the actual insurer,
So-
and Aetna manages it.
Okay, so Aetna is on this list. So that's
But
a,
because it's a corporate plan, customized plan, it's public.
if Aetna's managing the plan, I would bet you're safe, but I would still want to check it out. Okay, and I've got to talk to Alyssa, who's the new Director of Health Services, because what I was really aiming for was a couple staff that you could call their number and ask them specifically about your insurance. I didn't get real far with that, so I'm still working on that. But I wouldn't tell you not to do it. But I'd try the corporate office first and see if they can pull some strings. I know my girlfriend just had to go to People First in Florida because the Blue Cross Blue Shield couldn't answer her questions, and it was about her retiree insurance. Yes?
Years ago, when Medicare first started, they reimbursed the customer, the patient, for the unused expenses. And you can imagine what happened to that, so they stopped it. The doctors took charge and had to do all the filing. That's why some doctors won't accept it. Only a couple of months ago, I read in the paper that they're now considering reimbursing the patients for the unused, for the copay.
There's a whole...
Can you imagine? Is that just a political ploy?
No, there's a whole bunch of projects out there right now. I'm on this board for a accountable care organization, ACO, out of Leesburg, which covers a huge geographic area in Florida. And they're doing a model program for CMS on managed care and the patient's responsibility and all. And I still don't really understand all the details of the model. It's very complicated. It's like this thick, and I personally don't think that's going to happen. I mean, you know, there's certain people that don't think we should have Medicare at all. Yeah.
And then the hospital came out their zillions of dollars. Oh, I thought that was money.
Right. It's a real burden on the hospitals and the doctors to have Medicare, to take Medicare, because of all the reports they have to do and all the accountability. I mean, just to tell you another little story is, if you get pneumonia and you go in the hospital and you're not given a certain antibiotic within so many hours, the hospital gets dinged by Medicare.
You think that will pass?
That already is in existence. There are certain elements that are monitored by Medicare in the hospitals. What you got? What is it? What's your question?
I wondered, is there anybody here at Westminster that could confer with me individually?
So the answer is, I don't think so. I don't personally agree with that, but the people that do that are under some laws.
See, I have supplemental insurance from the state of Florida. They pick their own
But the state of Florida,
medicine.
the state of Florida has Blue Cross, and they also have an Aetna.
I can't understand.
The state of Florida also has Blue Cross and an Aetna plan. So depending on which one you have would depend on what the coverage is. I'm working on it. I'm working on, they don't want to get zinged by the state for trying to tell any of us what insurance to buy. So it's hard for them to agree that an employee of theirs can do one-on-one guidance. I disagree with that, but I'm not the state monitoring them, and they have to be careful. Marilyn can tell you closely.
I'm 96 years old. I can't hear very well. I have hearing aids.
Sure,
Can't see very well.
I understand, and I have been cheerleading for this with the administration here. But they can't, at this point, give me a workaround. Do you have somebody that's a power of attorney or a son or daughter that help you with your business stuff?
My daughter has my power of attorney.
So then I think that your daughter needs to get into the website and try to help you figure it out. I'm always available for conversations, but I can't take that on. I'm trying to get the organization to find some way that they can help people, residents with this? And I don't know what the answer is myself, except that, you know, we need a little place where we can sit down and look at things and have somebody help you look at the plans. And I'm really trying hard on this. And I think that the Residents Council, you know, it may be something to discuss with the Residents Council, that I said I wouldn't even do these talks this year until we had that in place, and then I gave in because we didn't have it in place, and I thought we needed to do it anyway. So I don't know, we're almost to the end. There's other stuff. If you want more details in these little last 2 pages, they're right out of the Medicare website. But are there any other things that you know of that were, yeah, Betty, lady.
One of the things is foreign travel. I have a lot of information on foreign travel. There are a lot of different agencies. If you go with a tour group, you're pretty straightforward. You can decide. But it's very expensive. There are a lot of different ways to get insurance to cover costs if you're overseas. And if people want to know more about it, I'm glad to share the information I have. Because you really can travel overseas at our age and not have insurance.
Yeah. I mean, my friend who just had the hemorrhage was 70. Didn't buy travel insurance, he and his wife. Healthy, they thought. And I'm going to just pass those and y'all just pass them around. And $250-something thousand. Just go ahead and take those and pass them back. No, he's got a pile of them. So Alyssa, the new director, I asked her if she would come. She was going to come, but then she said she better not. So she sent me this list of who they're contracted with currently in Porter McGrath. So my suggestion to you is first look here and see if, hey, yeah, and then check your own insurance plan to make sure it covers what you need it to cover. And I know a couple people in here are kind of mandated into certain kinds of plans based on their retirement from someplace else. But I would, if you are in that situation, I would think that you need to negotiate with your corporate office as to how you can be appropriately covered here. Because if you have an Advantage plan that's from Georgia, it's not going to have the doctors and hospitals here on that plan. And so those are the kind of things. Just know that we're going to do this again in October, and I hope I have more answers by then of if there's people locally that will be able to help. And if not, maybe we can recruit 3 or 4 of us with healthcare backgrounds on the resident side to put a project together and do that. Because I understand, you know, the paid employees, it may be tricky, but some of us could do it if we got together. Any other situations or questions? Yes?
Getting back, I have Medicare supplement, Part F, Plan F,
United?
United. And then I have a drug plan,
Mm-hmm. So you have traditional Medicare with a United plan. And remember, United, Humana, they have both Advantage plans and regular plain old supplements, and they have 5 versions of each. So you have to find the one, and if you don't know how to do it, you've got to push to get somebody to help you. Yes? If it's not on there, then our skilled nursing is not contracted with them. I know she told me a while back that they were working on a contract with Humana. So they have to negotiate with the insurance company the rates. Yeah, let's talk about that. That's a good point. Yeah, let me mention this one thing. It doesn't really come to Medicare, but it's important. If you go to the ER and you stay overnight and you, let's even make it worse. Let's say you get put in ICU. you need to know whether you're an inpatient or an outpatient. Yes, you can be in the ICU and still be under observation as an outpatient. And then it doesn't count towards the number of days you need to be in the hospital, which is 3 nights, to be able to go to skilled nursing and have your Medicare pay. So let's go back. And it makes a big difference in your insurance and what they're going to pay or not. So when you go to the ER, if you get admitted, you may still not be an inpatient. So you need to ask, am I an inpatient or an outpatient? Another word could be observation. And that makes a difference in how your bill's going to get paid. So, yes, sir.
I admitted my wife this past weekend to the Bartow Hospital emergency room, and the doctor I talked to in the emergency room said that he was going to admit her to the hospital. So I thought that was a done deal. But then when later on, they came in and said that she was an outpatient.
And they had you sign a piece of paper that said you understood that, right?
So I argued with them about it, whether and they changed it.
So there is criteria for being an inpatient. Again, Big Brother wrote this criteria. Medicare comes down the pikes, okay? And if the doctor thinks you meet that criteria, they can admit you as an inpatient. If they're wrong, the hospital gets zinged. But it's negotiable, because I got it changed on my father, because I said, he hit his head, he's unresponsive, I have to, blah, 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 blah. How in the world can he be an observation outpatient? And we negotiated back and forth, and he said, okay, he meets the criteria, and he changed it. Now, why does it matter? Hold on 1 minute, Neil. It matters because if your insurance pays differently for outpatient care than inpatient care, right? So it makes a big difference. And then if it's really serious, and you might have to go to skilled nursing, if you're not in the hospital for 3 nights as an inpatient, then Medicare won't pay that bill. Now, Neil, I'm sorry, you've been... Okay, you have to be admitted as an inpatient for 3 days before your Medicare will click in and pay for skilled nursing after discharge. So, and they can go all the way back to the beginning and change it. So let's say, when my dad's was changed, it was on day 2. So he changed it back to day 1. But they get criticized. It's highly, it's awful. It's not really the doctor's decision. It's the criteria, if you meet the criteria. But you can argue that. Yeah.
My question is, what would Kamala Harris do with this mess?
I am not getting into politics.
She wouldn't have a clue.
I am not going, we are not going there. Are there any other thoughts, questions? You may want to come back in October. Maybe I'll have more information about a support system here. I'm working on it. I'm really trying to get them to find some legal way that we can provide support for each other. Thanks.
Where is the talk in October?
I have no idea.
Told you?
No.
Okay, then I'll email her, because I'd like to get that in the Lake Herald.
Yes, and let me just tell you, yeah, she did, and I do have it written down someplace. This has been such a...
Well, if you find it.
I will. I know it's in my planner.
Okay.
I need to talk to you about the politics behind this, because I don't know this place well enough, but the politics are unbelievable as to not wanting to help people in this as to living or anyone else on the computer to look up their stuff, and I just don't get it. I just don't get it. I have fought on it, and nobody, and a lot of it and I'm bad. Good, because I'm bad about that.
Don't even ask me how to turn that on and off.